Planet Earth has 7.7 billion human inhabitants. In the past 200 years, our population has exploded. By 2050, the projected world population will be 9.7 billion. The Earth is unable to sustain this massive human population. In 1945, a global organization called the United Nations was established with 51 participating countries. The representatives came together to discuss challenges and the responsibilities the world faced. Today, the United Nations has representatives from 193 countries and continue to discuss poverty, gender inequality, climate change, peace, and justice. In order to survive and prosper as a human race, the United Nations developed 8 Millennium Developmental Goals in 2000, including eradicating hunger, universal primary education, gender equality, to reduce child mortality, improve maternal health, and more. In 2015, the United Nations established 17 new goals for 2030 called the Sustainable Development Goals, with a focus on the same issues as the Millennium Development Goals, like no poverty, zero hunger, climate change, quality education, and gender inequality, and then new goals that pertain to good health and well-being, clean water and sanitation, affordable and clean energy, decent work and economic growth, industry, innovation and infrastructure, sustainable cities and communities, responsible consumption and production, life on land and life below water, peace and justice, strong institutions, and partnerships to achieve goals. The United Nations Sustainable Development Goals were developed to improve the lives of everyone despite their race, gender, sexual orientation, and socioeconomic status, and improve a better world for future generations.
The SDGs are an agenda to balance human prosperity with protecting the planet.
We need action from everyone, everywhere. 17 Sustainable Development Goals are our guide. They are a to-do list for people and planet and the blueprint for success.
Although there are 17 United Nations Sustainable Development Goals, this video will discuss the 3 that pertain the most to the dietetic profession. These include Goal number 2, to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. Goal number 3, to ensure healthy lives and promote well-being for all at all ages. And goal number 6, to ensure availability and sustainable management of water and sanitation for all. Hunger is both a cause and a symptom of poverty. That hunger exists at all shows the urgency of redistributing income and assets to achieve a fairer world. In order to accomplish Goal 2, Zero Hunger, in 2030, the main objectives include ending hunger and ensuring access to food by all people, in particular the poor and vulnerable, by ending all forms of malnutrition, by doubling the agricultural productivity and incomes of small-scale food producers, specifically women, to increase investment in rural infrastructure and agricultural research to increase agricultural productivity in developing countries, and to help limit extreme increase in food price by ensuring the proper functioning of food commodity markets. In 2015, there were 805 million people living with chronic hunger worldwide. In 2017, 151 million children under 5 suffered from stunting, 51 million suffered from wasting, and 38 million were overweight worldwide. According to the United Nations, it would cost $267 billion a year to eradicate hunger by 2030. That does seem like a lot of money, but the United States government spent $737 billion on the Department for Defense just last year. Considering the United States spends over $1 trillion on malnutrition, poverty, and hunger each year, this seems like a reasonable expense. Ending hunger is entirely feasible, but it requires action at several different levels. Brazil and Ghana have paved the way and shown the world how to cut down on hunger by cash transfers to the impoverished, raising the minimum wage, and investing in small-scale farms. So how can the United States follow in their footsteps? By growing and consuming a variety of crops, investing in family farmers to grow more, and by improving storage and transportation to ensure food gets to market. Although combating hunger and malnutrition in developing and developed countries has advanced, more aid and investments in sustainable food production systems and agricultural practices are needed to continue this progress. Goal number 3 was established to promote healthy lives. Although many people today are living healthier lives than ever before, there is still work to be done. About 95% of the world's population has some sort of medical condition. To improve public health, we must focus on maternal and child health specifically. 303,000 women died due to complications in pregnancy and childbirth last year. 2 targets related to maternal and child health the United Nations strives to reach by 2030 include reducing the global maternal mortality ratio to less than 70 per 100,000 live births, and to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortality to at least as low as 25 per 1,000 live births. Goal 3 also aims to end the epidemics of AIDS, tuberculosis, malaria, and other communicable diseases by 2030. There is currently a big push to achieve universal health coverage, including access to safe, effective, affordable, and quality services, medicines, and vaccines for all. Substantially reducing the number of deaths and illnesses from hazardous chemicals in air, water, and soil pollution and contamination, as well as strengthening the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol, is also on the agenda for the 2030 Sustainable Development Goals. Together, we can decrease the number of deaths caused by communicable and non-communicable diseases by supporting research and development for vaccines, as well as expanding access to affordable medicines. It is important to vaccinate yourself and your family to protect them. People are still dying from preventable diseases. This is unacceptable considering the massive amount of research that shows vaccinations save lives. Achieving goal number 3 will require the government to invest in healthcare as well as the population's participation. The last goal I will be covering is Goal 6, Clean Water and Sanitation. According to the CDC, 780 million people do not have access to a safe water source, and 2.5 billion people lack access to improved sanitation. Unsafe drinking water, inadequate availability of water for hygiene, and lack of access to sanitation together contribute to about 88% of deaths from diarrheal diseases. The main objectives for Goal 6 is to ensure availability and sustainable management of water and sanitation for all, achieve universal and equitable access to safe and affordable drinking water for all, to achieve access to adequate and equitable sanitation and hygiene for all, to improve water quality by reducing pollution, eliminating dumping, and minimizing the release of hazardous chemicals and materials, by substantially increasing water use efficiency across all sectors and reducing the number of people suffering from water scarcity, by implementing integrated water resource management at all levels, by protecting and restoring water-related ecosystems, including mountains, forests, wetlands, rivers, aquifers, and lakes, and by expanding international cooperation and capacity-building support to developing countries in water and sanitation-related activities and programs. Water scarcity, flooding, and lack of proper wastewater management hinder social and economic development. Water, sanitation, and hygiene has the potential to prevent at least 9.1% of the global disease burden and 6.3% of all deaths. So how can you contribute to this goal? Think about the way you use water. Fresh water is scarce. Only 2.5% of the Earth's water is fresh water, and 2/3 of that fresh water is locked in polar ice caps and glaciers. That leaves us with 0.5% of fresh water in lakes, rivers, and groundwater for agricultural, industrial, and personal use. That being said, 0.007% of the world's water is considered safe for consumption. That small percentage of fresh water needs to be distributed to 7.7 billion people. So being aware of how much water you use is essential. Rather than taking a 20-minute shower, take a 5-minute shower. Don't leave the water running while brushing your teeth. Only do laundry when you have full loads. And always remember that what you wash down the drain has an impact on the water quality. So how have the United Nations Sustainable Development Goals been helpful? Efforts to combat hunger and malnutrition have advanced significantly since 2000. The number of undernourished people worldwide declined from 15% in 2000 to 2002 to 11% in 2014 to 2016. The maternal mortality ratio has declined by 37% since 2000, and globally from 2000 to 2016, the under 5 mortality rate dropped by 47% and the neonatal mortality rate fell by 39%. Globally, the incidence of HIV declined from 0.4 to 0.26 per 1,000 uninfected people between 2005 and 2016. In 2015, 6.6 billion people, over 90% of the world's population, used improved drinking water sources, and 4.9 billion people, over 2/3 of the world's population, used improved sanitation facilities. Although there is still a lot of progress to be made, the United Nations and their representatives across the globe have changed the world for the better.
And we commit ourselves as nations, as one world, to the urgent work that must be done, to standing with families like Eva's as they work and strive for a better life, to ending the injustice of extreme poverty, to upholding the inherent dignity of every human being, whatever it takes. We cannot let them down. And with your help, we won't. Thank you very much.